I love surgery. I love using my hands to fix problems and fix conditions, and it's something that really fulfills me at the end of the day. My name is Emily Kunkel, and I am a minimally invasive and acute care surgeon at Mainline Health. My main clinical focus is minimally invasive surgery, so that's surgery using robotic or laparoscopic instruments. It results in smaller incisions and faster recovery for patients. As a minimally invasive surgeon, I also focus on different areas such as foregut, including benign diseases of the esophagus, small intestines, and the stomach, as well as hernias and abdominal wall reconstruction. So using the robot lets me have better visualization during surgery, more precision. It utilizes small incisions and lets patients get back to their normal life quicker. Shorter hospital stays, a lot of my surgeries, the patients will go home the same day. I think robots are constantly changing, and as technology gets better, there's always new advancements in the tools that we use. So I'm excited for all the different things that are to come that can ultimately help our patients. I think it's really important to listen to each patient. Each patient has a different story, and the treatment requires a personalized approach to each patient. Mainline Health is a high-volume center that treats a wide variety of very complex conditions, and I'm happy to work alongside surgeons that can treat a lot of different pathologies, and we have a very collaborative approach. And if there's ever a chance that I need some subspecialists, there's always somebody available and somebody that's capable of doing some very complex and specialized procedures. What satisfies me the most is giving patients good outcomes and getting them back to their life quicker.